Welcome to RUMC Connections. Welcome back to RUMC Connections. If you tuned into our last episode, you know we had an eye-opening conversation with Stephen, Nico, and Amber Ramos about RUMC's Peer Advocacy Program and how it's transforming the lives of young people facing addiction, peer pressure, and difficult home environments. We barely scratched the surface, so today we're continuing to dive even deeper into the challenges, successes, and future of peer advocacy. Stephen and Amber, welcome back. Thanks for joining me again.
Thank you.
Let's jump right into things, Amber. So I know you're involved in outreach, with schools and community-based organizations. So how do you reach, young people before they necessarily reach a crisis point?
I would say outreach is one of my favorite resourcing that we do as peer advocates.
Yeah.
One of my favorite activities as a peer.
Getting out into the community.
Yes, because it helps you educate yourself on what's out there.
Mm-hmm.
The footwork is very important. But for future clients or just people in the community that, are a little hesitant on receiving resources or knowing what peer services actually do, it's really about educating on what is out there.
Mm-hmm.
I think as for me, I didn't know any of these resources were even available.
Yeah.
So for me to learn as well, if I'm not sure what's out there for different demographics, and then teach, clients on what I found,
Mm-hmm.
it almost builds some type of, trust factor. And if I can't find out, I know my peer is going to be able to do that. So we go to different organizations. It ranges. It's such a broad place to start in Staten Island. It's like the teaching ground for anyone who wants to do any field work in the future. But we have LGBTQIA+ resourcing, the Department of Probation, GED, adult literacy programs, high schools, rehabs, detox. I mean, the list, Project Hospitality, the list can go on. It's amazing. And we provide harm reduction education with xylazine testing strips and fentanyl testing strips, along with Narcan trainings and education on how harmful substance abuse is on the body and the mind, and some of the ways that we can educate ourselves on the evolvement of substances as well, because I don't think the adolescents know exactly what they're putting into their body.
Mm-hmm.
The more we educate ourselves and the more the deeper we go into the education. For example, there was a scenario where I had done some research and spoke to a few people, and they let me know that the dealers are using old marijuana and drying it up and putting fragrance that is artificial to make it smell good and flavored. So you don't know what exactly you're ingesting into your body.
Mm-hmm.
And that is aside from the fact that fentanyl may be put into these substances as well.
Which seems to be running rampant, especially here, right?
I think the idea for teenagers and young adolescents to know that they are smoking mold is, a piece of information I don't think anyone expected.
No.
It makes you rethink, how we deliver the message as well. It's really, we want the best for your health, not to tell you what to do, but to be able to be on the same level as you and to reach you where you're at.
Of course.
That's just one example of what we do.
Absolutely. So, how can family members and loved ones support someone who's, maybe struggling but a little hesitant to seek help?
I would say being open to the education. I know a lot of, I've spoken at middle schools as well, and the staff educated me on how hesitant parents were in learning about substances. So I think that was not a shock to me, but almost a concern, because these kids are learning at a faster pace nowadays.
And I've seen a lot of this deal with the families. Unfortunately, when you walk into a situation, it becomes, for them, a confrontation. What I like to bring it as is a carefrontation, approaching it from an entirely different level. Now, obviously, the parents are always going to be divided. 90% of the time, it's the mother who is sadly the enabler because she thinks she's doing the right thing for her child, whereas the father is pretty much at wit's end and doesn't really care which way this goes anymore. It could be challenging, but I like to approach it where I can get everyone on the same page because the parents' voices matter.
Of course.
It should, because addiction not only affects the person who's going through it, but it uproots an entire family foundation. I mean, it could just destroy it. So, we try and I'll try to calm them down, reassure them. Like, this is a great thing. Trust the process. Let's do what we do to help him or her, because at the end of the day, that's your child. I get it. And you want to see your child in that happy place.
Yes.
So we'll talk to the father, and then I'll talk to the mother, and I'll bring them together. And then we'll sit down. And if that's where you want to air your grievances, then that's where you air your grievances.
Yeah.
But it's more of a confrontation. And I think it's proven that if you can get everyone to communicate and be on the same page, it's going to work.
Yeah. I like that term.
Yeah.
It's a good one.
I come up with a good one now and again.
Okay. So, how would you say, the field itself of peer advocacy has evolved over the years? How long has this been around, maybe even just at RUMC alone?
When it started, it wasn't peer advocacy, it was recovery coach.
Okay.
When you got your recovery coach certification,
Yeah.
it was like, okay, well, now you have to explore peer advocacy. They didn't tell you about peer advocacy. I got my slip. I'm thinking, wow, it's great. All right, I'm in a new field. This is going to be great. And they're like, yeah, good luck. You have to pursue this. And it's much easier now through the benefit of computer.
Yeah.
And now you can actually talk to living human beings on the phone, whereas it was like pulling teeth back then.
Okay.
You called this number, you called that number. Nobody knew what was going on. It was a wild goose chase.
Yeah.
You wind up going to school here, and then you got to go to school there. Everything now is the benefit of online, so it's much more simple. But back then, it was definitely tricky, I should say, because there was no one to guide you. It was like, okay, here's your certification. Congratulations. Now you need to be a peer advocate for the recovery coach to mean anything. Well, how do I become a peer advocate? I don't know, but there's a number. Try calling them. Let's see and that's what you got back then.
Wow.
It was kind of just thrown out there, and it was good luck trying to put the pieces of the puzzle together.
And what year was that?
Oh, man, I'm going back 12 years ago.
Wow. Okay. So a lot's changed, with with all the technology and being able to Zoom and do all of that.
Didn't have it. I had to go to the Bronx for a week for school. I had to go to Queens for a week for school.
Okay.
I had to intern. Well, you still have to intern to get your hours in, but, it was so much involved because you had to have the right courses.
Yeah.
No one gave you the courses.
Okay.
Core competency, medication-assisted training. Nobody gave you that. You had to actually do the legwork and look it up for yourself because nobody knew. But now it's so simple.
Okay.
It's just, it's gravy right now
Yeah.
if you want to become a peer advocate.
Okay.
There's nothing hard about it because the barriers are broken, and now it's just more simpler for someone to say, all right, you know what? I want to dedicate some of my life and time to help someone who's losing their life and time.
I think they're also paying more attention to the audience as well, being more diverse, branching out peer advocacy into different departments. So they have a youth peer advocate, a judicial peer advocate.
Criminal justice peer advocate now, which is great, which that's going to be the next thing I want to explore with my law enforcement background. I'd like to explore that a little bit. You have HIV peers, hepatitis C peers. I want to see more of community peers. I want to see more boots on the ground. I want the peers to be in the areas where the people are feeling it the most. So right then and there on the spot, they can make a referral. And if that person surrenders, you can be that person to kind of warm hand off them to wherever it is that they need to go to get the additional help. I think I'm a big advocate for community peers, and I hope we can get to see more of them because it's where it starts out there.
Yeah.
Family peers, LGBTQIA plus peers, the list goes on.
It's growing.
That's fantastic because
It's
everybody,
growing. The peer
needs
program
somebody.
is blossoming.
But But I think
before our eyes.
the most important, which is really why I began this journey in the first place, would be the significant other portion. Just being a family member of someone who is struggling and is or may not be in treatment, that really, forwarded me into pursuing this as a career. So to know that there are resources for the other party as well, it's really nice to see.
Of course. So with all these advancements, are there any upcoming programs or initiatives that are happening at Silverstein?
I have been in discussion with some of the managers in my building, what I would like to see. When you walk into our hospital or you'll see these functions where there's some kind of awareness, lung screening, breast cancer. Well, I brought up the idea, well, why not make an addiction awareness? Let's set something up where parents now could come to us or families could come to us and say, okay, my son or daughter is going through A, B, and C. What do you suggest? And kind of listen to them, hear them. What are the signs? What are the signals? What are you seeing that makes you think he or she is going through something or battling addiction? Obviously, provide Narcan kits, information, let the families know, okay, we're here. Silverstein is here to work with you for the betterment of the entire family as a whole. And I think we should set something up like that. I think it's important that us, as for what we do, we are in the community, so the community could see us and say, hey, you know what? I want to entrust my son and daughter to their care. I think it would be worth it.
Yeah.
And again, it breaks barriers too. It breaks a lot of barriers because it's the thing they don't want to talk about because of a stigma. And they feel, oh my God, what are the neighbors going to think? Or what is this one going to think? I get it all the time.
I'm sure everyone's worried about judgment.
Right. You get through the judgments. There's ways.
Yeah.
And I tell them, let me show you how. Let me show you how we can brush aside the negativity and let's focus more on being positive. And I think it would be good if we can do some kind of outreach with that and just enlighten and inform.
So, Amber, I know you're furthering your education while working in advocacy. What do you hope to do with your degree in the future?
This is a funny question because I'm currently in my process of figuring out if I want to be clinical or non-clinical.
Okay.
So whether mental health strictly or, working and furthering a clinical aspect. But, all in all, it all ties together.
Yeah.
So going back to school and just furthering my education, like you said.
Nice.
Perfect.
Okay. And, how do you, train and prepare maybe new peer advocates, for this important type of work?
I basically tell them what to expect. We listen intently and carefully. It's not about us. It's about them. And I tell them, just trust your instincts with this role. If you hear something that you think is not beneficial towards the person, then trust your instincts and say, hey, listen, what could we do to make it change? What could we do to work through the boundaries? Where are the obstacles here?
Okay.
I tell them, just listen. Put your eyes in their hands. Put your ears in their hands. Just look and listen. Come from here, not from here. You come from here. Let them see that, and it's an effective technique because they want to believe that they're doing something for somebody and that it matters. And it's really simple. I tell them, just listen, pay attention. Don't be afraid to ask the big question because sometimes the boundaries that you will see, they're putting them up. And we have to learn to work around the boundaries and how we can break those walls down and get the patient to really want to buy into what you're saying. Subscribe to the theory that everything you're saying is heartfelt and sincere and real and warm and true.
Living your truth, I would say.
There you go.
And owning it and not being shameful. That's, I think, the biggest beauty that peer advocacy has is that you take your story and you make a purpose out of it, which could be very healing for anybody in recovery. And knowing that you can make a difference in a community that you felt like you didn't have a voice in, or maybe you couldn't speak on behalf of the parent, that you were watching abuse substances, So the fact that you are able to reach different audiences, it doesn't have to be anyone in your age group, but it could be any other category that you can pick from and help. And the resources that you may have not had, you are able to tell other people. It's very healing, I would say.
Absolutely. If, you could maybe change one thing about the way addiction and youth mental health are approached in society, what would it be?
First and foremost, the stigma that it has, where a lot of youth come in, and whether it be from the community or a parental figure or just people who don't have understanding of what substance use is, I hear a lot of, well, why can't they just stop smoking? Or why can't, they just go to school? Or why can't they just do the right thing? And it's layers of different aspects that may be affecting their life. They could be going through trauma. They could be lack of resources to help them go to school and not really having a purpose, or just having co-occurring mental health disorders that may be undiagnosed. Some parents don't believe in getting their child mental health treatment, let alone substance abuse. They don't even want to talk about it. Not my child. That's another stigma that I see. And even while in recovery, I feel like at a point, whether it be the young adult or the parent or whoever is, chaperoning at that time, may want to stop the treatment, seeing no progress in their child, and not feeling like it's worth their time bringing them here. A lot of people need to see that it's working. Yeah. And sometimes it's beyond the surface.
Of course. I can imagine that there's, if there's so many layers to something, that it's not going to be a 1, 2, 3. All right, you went for 5 visits, you're fixed,
And then other schools as well, I can only imagine, you have so many students. I don't see how you can help every single one of them. You may not know who's going through anything because they have such a brave face.
Which brings me back to my original comment on community peers. I think how that could possibly level the playing field, so to speak. Give that child who's feeling something, give him someone that he knows he could talk to. Listen, children are not very trusting when they come to a certain age, right? It's almost impossible to get through to them because their mindset is just in a way that, they're kind of geared to do what it is that they know or what they think is right. And as community peers, you could be that voice for them.
Yeah.
And they, trust is the primary ingredient in any relationship. So I think a little trust goes a long way.
Absolutely.
And I think if you can get the youth to see that we just want to hang out and have a good time and talk sports and play games and just do the same thing that you can do, but let's always keep it centered around recovery or about mental health, then I think you could reach a larger base audience like that. I really believe that.
Okay, so Stephen, I know you have a very extensive career in corrections before you transitioned into this role. So what inspired you to move from that into peer advocacy?
When I retired from corrections, I obviously, as you know, I took the job in CPEP as security, and that's a psychiatric emergency room. And I thought to myself, well, this wasn't really a well thought out plan, retiring from corrections to become security in a psychiatric emergency room. I noticed when I was there, I really got to talk to a lot of people coming in. Got to share a lot about my past with them, where I came from to where I am now. And it hit, and the nurses and the doctors appreciated that because it made their job a little bit easier because I get it. That could be a very trying area because of so many different things, so many moving parts down there. It's hard to just keep it centered on one part.
Okay.
And I felt I was reaching out to people and touching people in a way that they wanted that because they looked at me, security, they didn't think I was, the guy in brown or the guy wearing the white. I was just an average Joe. And I said, you know what? I think I can pursue this. And it's funny because getting back to when you started out as a recovery coach, I had been a recovery coach at that time, but I had no follow-up to be the peer advocate. While I was in there, one of the techs at the time came to me and said, I think you should look into this. Yeah. And I did. And the rest is history. Okay. And here I am now. I was, I'd have to say Thank you, because it was Mike Matthews who actually interviewed me to be a peer for the hospital, one of the interviews. And, I get to share where I came from to where I am now. And that's just so cool. And I knew I couldn't just do security. I felt that there was something more I had wanted to try to accomplish. And communication's so key. The mouth is a person's best secret weapon. And you could just talk through anything and everything. And you just want to get their attention. And that's what I was accomplishing in there. And now I use it to what I do now. And I'm very grateful for that. Very, very thankful for the opportunity, actually.
And how about yourself? When did you know that this was for you?
I feel like in different points of working in different departments, I started off in the emergency room, which was, not the first choice as a first peer, just because it was very intimidating. However, I was ready to accept the challenge, and Denise Nazari actually hired me, and she saw something in me that I guess I didn't see at the time. So, with the team that I had and just being able to work with the whole population at the most vulnerable state of being brung into the emergency room, whether it be by choice or not. And in the state that they were in, they could, feel a lot of regret for their decisions and be a little emotional about how they could have done things differently, or they could have been intoxicated and not really knowing their surroundings and whatnot.
Yeah.
So I think from there, just putting yourself in places that you're not comfortable with actually highlights some of the points as to why, you're here in the first place.
And not for anything, but you started in the ER in one of the most difficult times in healthcare history. It was during the COVID-19 pandemic, right?
Yes.
So what was that like?
It was all hands on deck. I think everyone as a unit, the whole emergency room, were trying to figure out how to implement different protocols, how to be safe. And it was very interesting because a lot of the non-clinical staff actually went to work in offices in different, parts of the hospital. They looked at me and said, your bedside intervention, you have to stay in the emergency room.
Wow.
So here I am with a whole hazmat suit, just, ready for the adventure. But it was a more personal experience than I anticipated. And I was able to learn my purpose as to why I was there. And at the time, the world was vulnerable. The whole island, Staten Island, was vulnerable. Yeah. So it was a different type of connection. And I'm grateful for being able to provide, peer recovery to people at a very lonely, very scary time. Yeah. And it then kind of treaded into what I do now.
Wow. Mm-hmm. That's beautiful. Mm-hmm. No, especially during such a challenging, time. Wow. Okay. So, Stephen, how would you say that, your experience working in Department of Corrections, helped shape your understanding of addiction, and at-risk youth?
You get to a point in your career there that you believe de-escalation was a big factor. We didn't call it de-escalating back then. We called it IPC, interpersonal communication skills. Same concept.
Yeah.
Where you can actually talk to somebody. And I used to see a lot of the young adolescent inmates come through. Friday was known as kiddie court day because all the kids went to court on Friday, saw a particular judge, and he would decide what was going to happen with them. So I would have all the adolescents in one, bullpen, and, I would talk with them. And I got to hear so many different things that came out of their mouths just based on their lives and what it was like for them to grow up. I said, giving a little bit of advice to these kids.
Yeah.
Because truth is, they've done nothing to me at all. Mm-hmm. So my role was just care, custody, and control. I was partial, but I listened, and I felt giving to them, talking with them could maybe help them out. And it did. It really did, because a lot of kids got it, and unfortunately, a lot of kids just couldn't get it. But you hope eventually in time that they would learn to get it before they got much older. My stories and everything that I had been through, to where I came from, to where I was now at that time getting ready to retire, it helped out a lot. Mm-hmm. And a lot of people saw that. A lot of people caught on to that, because I was like, listen, I know what you're going through. I kind of get it. I feel it. I hear it. I hear it in your voice. Why don't you listen? And how about try this approach? And it became an effective technique for me, talking. And it did de-escalated a lot of situations. And the truth is, that's what you could hope for.
Yeah.
That's all you wanted. A happy medium at the end of the day where everybody got to go home the same way they came in. That's your ultimate, that's the end game there.
Yeah.
And it worked. I think it worked. And, you know, I had partnered with some very good, very fine correction officers that were my partners. So we all kind of fed off each other in that respect as well, too.
Do you want to share a little bit of your story?
Yes. I did a lot of bad things in my life when I was a young correction officer. Very bad. I wasn't very good at home. I wasn't good to my family. I just wasn't a good person. Drank, took it home, made a promise I wasn't going to do this anymore because I saw the bottom was starting to come out and I was distancing myself more from my family. And so far, so good.
Yeah, that's wonderful.
So far, so good.
Of course. Just curious how you got, from where you were to where you are today, of course.
It uproots everything. I said that. And your family doesn't want to be around you. Your friends don't want to be around you. Nobody wants to be around you, but you can change it. And I tell people, listen, you want people around you? You have to prove it to you first that you want to have people around you. You have to follow the simple, basic instructions to this. Just being honest with yourself, being honest with others, self-awareness, taking inventory, utilize consequential thinking. We give you tools. Yeah. And you have to know what tool to use that's in your toolbox at the right time, I should say. It's effective.
Of course.
It's definitely effective.
What would you say it was like when you were transitioning from, maybe a security-focused role to a mentorship and advocacy role?
Thank God I didn't have to wear a uniform anymore.
Okay.
I'm so glad to get out of that uniform.
Yeah.
To me, it was just no different. It was just a smooth transition. Yeah. You know, I spoke to people, to patients that were coming in to try and get them to relax and calm down and trust the staff. Same difference. They come to me and I try to get them to relax and calm down and trust our staff. Yeah. You know, just trust the process. It was not a big, significant change in my life. To me, it was just roll smoothly right over.
Yeah. What would you say for both of you maybe has been the most rewarding part of your journey?
The thank yous.
Yeah.
From any age group where people would come back and be very honest in how much they struggled and letting you know that you were such a big role as to why they have what they have at this point, or they reached the goals that they needed to, along with a client just being very open into needing help as well. It doesn't have to be a success story. It could be, you're my point of contact when I feel like I didn't have any at the time. So success can also be, I need your help. And I'm the person that you called. Wow. That's wild. That's what I would
just
say.
To be able to reach out and express that. Yeah.
Same thing she said.
Yeah.
Really, it's just families can trust you.
Yeah.
And, they want to say, it's because of you this or because of you that. And I shut that right down. I say, whoa, wait a minute. No, it's got zero to do with me. Here's my role. I'm the messenger. He or she either accepted the message, grasped the message, and took the message and ran with it, or they wanted no part of it. All I do is spread the message. I tell them I have this big, giant basket, and it's called recovery. And I want to pass it to you. But I'm going to leave it here. When you're ready, take what you want from it.
It's there for you.
It's there for you.
Yeah.
I'm not taking it back. Now it's yours. Or you could pass it on to somebody else. Definitely echoing what Amber said.
Of course. And I'm curious, what led you to transition, maybe from working with adolescents to young adults?
I was in the emergency room and I spoke to a patient at the time. Had to be in his 60s. We would call him a reoccurring patient, and he was at a point where very emotional and had no hope in his recovery. And this was around the time that I was wondering what my role is in recovery,
Mm-hmm.
being a young peer at the time working with 18 and older, but the population was really 40 and up who had been drinking or using opiates for a very long time.
Mm-hmm.
You know, I got a lot of bias into how would I be able to relate
Because of your
to the
age.
role. And that was the start of a question that I had to figure out. And I remember, you know, the patient was very upset and he asked me, how could you help me? And I was just honest and I said, let's try to figure it out together. What are you struggling with at this moment in time the most? And he mentioned the effect that it has on his children and not being able to make birthday parties and, you know, spend time. And his kids were getting older and he couldn't be there to watch. And I took a pause and I said, well, how would you feel if I was to tell you that I was your child's shoes at some point in time? And this is my perspective on it. It changed the whole conversation where they began to start asking me questions. How did I feel regarding this? How did I get help? And that led to me bringing up the Center for Young Adults. And if you're not going to focus on your own recovery, why don't you educate your family on how they can receive help? You know, because, you know, at that point you lose hope into thinking that you can do anything for yourself. And once you see your family getting help, maybe it'll motivate you to get help. I didn't realize how big that was at the time, but when the position opened up, I just had to take it.
Yeah.
And it's so rewarding being able to work with people my age, not only my age, but also within significant other, because I wasn't able to get the experience that I wanted to until I started there.
Okay.
And it became so educational in every aspect, between resources, between working with families, with the clinicians. I never thought I would be sitting in a room with parents and a, you know, adolescent having the same conversations I've had growing up. And it was such a different third-party perspective.
Wow.
And so rewarding at the end of it to see that there was actual progress made. You know, I'm learning something new every single day, and it's really nice to see.
Beautiful. I love to hear that. Maybe we can just share one last message you know, maybe like to leave with listeners who are struggling themselves or know somebody who is.
Early intervention is the best intervention. If you think or you feel or you might have this strong suspicion, I always say trust your spidey sense. Because 9 times out of 10, it's right.
Yeah.
Advocate for that person. Let them know you care and you love them, and let them know that we can go through this journey together. Have them call somebody. Call Silberstein, 718-818-6970. Ask for any one of our therapists. Ask for me, the peer, Stephen Nico. Ask for Amber, Ramos. If they're young adults, we have the tools. Just trust that you can take them.
Well, Stephen and Amber, I would like to thank you both so much for joining me today and for all the incredible work that you do for our community. As Stephen said, if you are struggling with addiction, you know, peer pressure, a tough home environment, or you know someone who is, RUMC's Peer Advocacy Program is here to support and guide you. You can contact the Silberstein Clinic, 718-818-6970. You could visit rumcsi.org for more information. Thank you once again for tuning into RUMC Connections. Be sure to subscribe, stay connected as we continue to bring you conversations that matter. Thank you, guys.
Thank you.